How do you diagnose pancreatic cancer? So the diagnosis of pancreatic cancer is a slightly challenging area. The most common test when you have some abdominal discomfort in the upper abdomen, patients go to a doctor for an upper GI endoscopy and an ultrasound. Unfortunately, neither of these two tests can pick up pancreatic cancer. So, an ultrasound, because I said pancreas is located really in the back of the body, it's located behind the stomach and the intestine. So because of the intestinal gases, you can't see the pancreas properly. And on the endoscopy, obviously it is only the intestine, and pancreas lies outside the intestine, so you cannot see the pancreas properly. So it is a big problem for us that many patients have a lot of abdominal symptoms, vague abdominal pain and abdominal discomfort. They undergo multiple times ultrasound and endoscopy, and the pancreatic tumors are missed, and then by the time they come to us, they present at a fairly advanced stage. So once you have a suspicion of pancreatic cancer, sometimes an ultrasound can pick it up. I mean, when you have pancreatic cancer in the head, which is causing jaundice, your ultrasound can actually pick up the liver has become swollen, and the ducts inside the liver have become swollen. But especially when you have a suspicion of pancreatic cancer, the best investigation would be a CT scan or an MRI. The CT scan or an MRI not just tells us gives us a diagnosis of pancreatic cancer, it also tells you what stage it is at. Is it located within the pancreas? Has it involved any blood vessels? Has it spread elsewhere to the lungs or the liver? Once you have the CT and the MRI, sometimes we also do a PET CT scan, whole body PET CT scan, to actually stage any distant spread of the pancreatic cancer. In some cases, the CT and the MRI is enough to diagnose pancreatic cancer, but in some settings there is always a diagnostic dilemma, especially when you have chronic pancreatic cancer in the setting of chronic pancreatitis, or when you have a neuroendocrine tumor. You need to get a confirmation of pancreatic cancer by doing a biopsy test. So even for the biopsy, unfortunately, because the pancreas is located in the back part of the body, it's very inaccessible location. It's very difficult to get a biopsy. So most of the time we do something called an endoscopic ultrasound. So we put an endoscope at the tip of the endoscope. There's an ultrasound machine that goes into the body, and we put the endoscope, the ultrasound machine, just next to the pancreas, and then we take a biopsy, or sometimes if there's cystic neoplasms of the pancreas, we can actually aspirate the fluid and send it for testing. So the EUS endoscopic ultrasound plays an important role in the pancreatic tumor diagnosis. There are some blood tests used to diagnose pancreatic cancer. The tumor markers like CA19-9 and CEA can be used, but the problem is these are not elevated in all pancreatic cancers. That's number one. And sometimes other conditions can also lead to, like pancreatitis, inflammation of the pancreas can also lead to elevation of these tumors. So these markers are good for follow-up of these pancreatic cancers, to see if once you do the treatment, has the tumor come back for follow-up. But for diagnosis, the tumor markers are not very useful in pancreatic cancer.